Hello, I'm Dr. Daniel McKenna, a bariatric surgeon with Aurora BayCare Medical Center in Green Bay, Wisconsin. I'm board certified by the American Board of Surgery. Welcome to this free, on-demand bariatric surgery seminar. With me today is Dr. Anna Pierce, also a bariatric surgeon with Aurora BayCare Medical Center.
I'm Dr. Pierce. We're here to provide an introduction to weight loss surgery, also known as bariatric surgery. Our goal in this presentation is to answer your initial questions and provide you with factual information to help you make an informed decision about surgical weight loss options. Bariatric surgery is a powerful tool that could be your next step down the path of improved health and wellness.
This on-demand seminar is provided to you as a convenience. Its online format allows you to view at your own pace and according to your own schedule.
It's also the same content provided to prospective patients during our in-person group seminars. With that being said, let's begin our presentation.
You being here today is a step toward better health tomorrow. There are several things we want to talk about. First, what obesity is and the weight loss options that are available to you. I also want to discuss the Aurora BayCare Medical Center and our own bariatric care team. Lastly, we want to discuss how together we can work toward better wellness and physical fitness tomorrow. The Aurora BayCare Bariatric Program works closely with Aurora Health. This is the largest health system in all of Wisconsin. There are 3 accredited bariatric centers, one in Green Bay, one in Milwaukee, and lastly in Summit. Our care team at Aurora BayCare consists of myself and Dr. Pierce and our physician assistant. She's responsible for the pre- and post-operative care of most of our patients. In addition, we have a bariatric care coordinator. She answers many of your questions before and after surgery. She's also responsible for making sure that all the things are in place to maintain Center of Excellence accreditation, to provide the best care possible for all of our patients. It's important to realize that Aurora BayCare Bariatrics has a team of physicians and care coordinators along with psychologists, dietitians, fitness specialists, and insurance specialists to make sure that the process is smooth and the care is superb.
So let's talk a little bit about what obesity is and about the surgical options available to you. Now, what is obesity and how do you define it? That may seem simple and straightforward, but it's important to understand a concept that something called BMI, or body mass index. And this is how we discuss the degree of someone's overweight. So what this is a formula that takes into account your height and your weight and gives you a number. Now, if that number is between 19 and 25, we consider that a normal, healthy weight. 25 to 30 is overweight. Over 30 is obese. 35 and above becomes morbidly obese, and those are the patients that are typically candidates for bariatric surgery. Now, a little later on, we'll talk specifically about what makes you a candidate for bariatric surgery. But when it comes to BMI, you need to be at least over 35 to be a candidate. BMIs of 35 to 39 may be eligible for surgery if they have associated healthcare concerns that can be contributed directly to their weight. Otherwise, typically it's a BMI of over 40 who are eligible for bariatric surgery. A little bit more about what obesity is. It is the second leading cause of preventable death in the United States right now. About 1 out of 3 adults are overweight or obese. Now, this leads to significant health burdens and financial burdens associated with those healthcare costs. We also know that being obese can shorten your lifespan by about 10 to 15 years. About 300,000 people die each year as a symptom mostly related to their obesity. It's also a very expensive health problem. Just on an individual basis, morbidly obese individuals spend about $1,500 each on health care compared to healthy weight individuals. That's about 41% more than someone with an average weight would spend on their health care each year.
Trying to get a handle on obesity is a huge struggle within our society. It feels as if every time we take 1 step forward, we're often taking 2 steps back. The reason is that as we attempt to make our workplace healthier, we still see menus that provide very cheap, affordable food in large portions. Of course, what we eat is going to play a huge role in what we weigh. While our employers may provide us with more physical fitness, gyms, other things, what we eat at lunch is really the biggest driver of where our weight is today. There are a lot of personal factors that contribute to issues with obesity. Of course, there's a large role for genetics in obesity. This seems to run in families, where families of multiple members will all be overweight or obese despite struggles with diets and exercises over the years. But in addition, there's a large social pressure. Food is, of course, at every social event. And failure to partake in food can sometimes be somewhat offensive or can make someone feel singled out. Thus, it is not unusual that people struggle a great deal around the holidays with managing their weight. Lastly, our psychological factors, anxiety, depression, and stress play a large role in managing our weight. We often want to eat when we are under stress or when we're feeling down. This is not unusual. The same reward pathway that is present when we eat something that is sweet or salty is the same reward pathway that we stimulate in order to treat anxiety and depression. These are things that can play a large role in our weight and trying to stamp out obesity. The food choices that we make play a large role also in what we weigh. It is not unusual that people often see it as expensive to try to eat vegetables and fruits, but often can find carbohydrates that are plentiful and very cheap. The issue is, of course, that what we eat on a day-to-day basis that consists of carbohydrates and simple sugars will often lead to a large weight gain. This is not easily managed when those foods also provide the most reward to that reward system that I had earlier discussed. Obesity has a huge impact on our health. What Dr. Pierce said about it impacting our life expectancy is directly related to it causing and being responsible for diabetes, high blood pressure, sleep apnea, high cholesterol. But it also plays a large role in cardiovascular disease and our risk of certain cancers. Those cancers include breast cancer and endometrial cancer. We know that with these problems come increased costs, increased doctor visits, hospitalizations, and medications. Many patients don't realize that even simply having a straightforward routine surgery becomes more complicated just by being morbidly obese.
Let's talk some more specifically about the bariatric surgery options. Now, one of the most common questions is, am I a candidate for bariatric surgery? Now, I want you to look at each of these procedures evaluate them in certain ways. First, most surgical weight loss options provide some degree of restriction. What that means is that you should feel full sooner after eating. The other thing is that they provide some degree of malabsorption. That means that the food you eat is incompletely absorbed, both the good and the bad. So fats and carbohydrates aren't absorbed as well, but neither are proteins, vitamins, and minerals. Now, your body is going to change the way that it responds to food because of this. We'll talk about that in detail with different procedures. But your meals are going to have to be smaller. You're going to take longer time to eat a smaller amount of food. Also, because of the malabsorption, supplements are going to become a part of your new routine. For the rest of your life, you are going to need to take multivitamins, calcium, vitamin D supplements in order to maintain high enough levels of the good things that you need. Now, this is frequently insurance driven, and Dan will talk about that a little bit more down the road, but the basics are outlined right here. At a minimum, you must have a BMI of over 40 or a body mass index of 35 to 40 with health concerns related to your obesity. We also have to demonstrate that you've tried to lose weight without surgery. This might be Weight Watchers, it might be a gym membership, but surgery can't be the first step in your weight loss journey. We have to demonstrate that you understand the procedure that you're having done and the risks of the surgery. We'll start to talk a little bit more about those risks for the first time later on in this slideshow. We also ask that you demonstrate an ability to attend follow-up visits. Now, part of this comes in your ability to attend pre-op visits regularly, but long-term it's incredibly important that we maintain follow-up. This is a lifelong commitment, and lifelong follow-up with someone who's familiar with your surgery is important. And next, it's very important to us that you're nicotine and alcohol-free before surgery. Doesn't mean you have to be nicotine and alcohol-free today, but at the time of surgery, we have to be there. Nicotine independently is a huge risk factor for many of the risks associated with bariatric surgery. So what are some of the procedures? We'll get into those in a second, but when you look at them, I want you to consider two things. First, the procedure is something that restricts the amount of food that you can comfortably or sometimes safely eat. So there's a measurement of restriction. It may make your stomach smaller, it may change the ability of your stomach to fill. The second thing is that it in some way provides malabsorption. That means that your body is no longer able to absorb the foods that you eat in the way that they do right now. Now, the downside of this is that it may not absorb healthy things like protein, vitamins, minerals, while at the same time not absorbing things like fats and carbohydrates. Now, the surgery, whichever one you choose, all three that we're about to talk about here in a second, they're all going to change in different ways the way that foods are absorbed by your body. Your meals are going to have to be smaller. It's going to take you a longer amount of time to eat a smaller amount of food. And it's important to understand that supplements will be a part of your new routine. Now, if you're on a lot of medications, part of your goals with surgery might be to get off of the blood pressure, the diabetes, the cholesterol medications, and that's great. But new supplements, vitamins and minerals are going to be a part of your new routine for life.
There are 3 operations that we offer at Aurora BayCare Bariatrics. These include the Gastric Bypass, or better known as the Roux-en-Y, the Duodenal Switch, and the sleeve gastrectomy. We do not offer the adjustable gastric band any longer. We also do offer revisional surgery for those seeking it. The gastric bypass has long been the most popular bariatric operation. While that's no longer true, it has been around for over 40 years. It has a great amount of weight loss associated with it and has a strong impact on diabetes, and the hospital stay is often 1 to 2 days. As you can see from the picture, the gastric bypass involves dividing the stomach into a small gastric pouch and then making 2 connections, one of the intestine to that pouch and another one a little bit further downstream where we connect the intestine to the intestine. This is the pathway with which the stomach contents and bile and pancreatic juice help with digestion. The other effects of the surgery are that people often don't feel hungry. This is a process that may last for up to a year to 1.5 years after the surgery. The disadvantage of the surgery is that it's a more complex surgery, and there is a possibility of having a leak. A leak occurs in approximately 1% of patients and can require another surgery afterwards. This usually only occurs in the first 1 to 2 weeks after surgery. Because of us bypassing a portion of the stomach and the first part of the intestine, there's a greater risk of nutritional loss and vitamin and mineral deficiencies. Because of this, you will require vitamin and mineral supplementation for the remainder of your life. The average patient does lose approximately 70 to 80% of their excess weight at 18 months after surgery.
The sleeve gastrectomy has in recent years become one of the more popular bariatric procedures nationwide. The sleeve involves removing a large portion of the stomach, usually about 2/3 of it. We take out the part of the stomach that has the most ability to stretch and hold extra food. So by getting rid of that, we do create some restriction. Your stomach is smaller. That part of the stomach is also responsible for secreting some hormones, one in particular called ghrelin, that affects your ability to feel full. It also takes out part of the stomach that can secrete different things like acid, which might help you digest different things or absorb different vitamins and minerals. The hospital stay for the surgery is the same as the gastric bypass, about 1 to 2 days. One of the biggest disadvantages or risks associated with the surgery is the potential for leak. The long area where the extra stomach is cut out has the potential to leak around the staples or sutures that are placed there to close it. Nutritional loss is a possibility with the surgery, and again, the vitamins lifelong are necessary. Weight loss with this surgery has not been documented to be as good as the gastric bypass long term. Typically, we expect about 60 to 70% of excess weight loss at 18 months after sleeve gastrectomy.
The last operation is the duodenal switch. This is an operation that has historically been the least popular of all the choices. That is because while it may achieve the most weight loss, it also has the highest risk for nutritional deficiencies and potential complications. With this operation, we're essentially performing the sleeve gastrectomy a little bit larger than what Dr. Pierce had described. We then bypass most of the intestine by plugging the duodenum into the ileum. This allows you to only have approximately 75 to 100 centimeters of absorptive capacity when you eat food. Thus, if you eat food that is high in fat or high in sugar, you may end up with diarrhea and abdominal pain.
So which procedure is right for you? This is a very popular and common question. Some people come to us knowing what they want. Others, this is the situation you're in. Now, the biggest factor in determining that is what you're comfortable with. Patient preference plays a huge role in what procedure is right for you. Bariatric surgery is an awesome tool, but you have to be comfortable using that tool. Now, surgical and medical history can, in some instances, try to encourage you in one direction or the other. For example, if you have severe type 2 diabetes or severe gastroesophageal reflux disease, we may encourage you to a little bit more strongly to consider a gastric bypass. If you've had multiple prior surgeries on your abdomen, in your intestines or colon, then depending on what those surgeries are, we may talk a little bit more about a sleeve. But ultimately, patient preference does play the biggest role.
The risks of the surgery are very well known by bariatric surgeons, but to patients, they often overestimate or underestimate this. This is based primarily on their own judgment and experiences. The reality is that bariatric surgery carries a risk of 5% for a complication within the first 30 days. That does mean that 95% of people go through and have no complications. The one we worry about the most is something called anastomotic leak. This is essentially leak from any of the staple lines that we've created or the suture lines. We do test these connections at the time of the surgery. Presently, this risk is usually around 1% in most series.
Bleeding is another common risk associated with this surgery. Now, Dan will talk a little bit about some of the measures that we do to decrease blood clots, and some of those can increase the risk for bleeding. We pay very close attention during surgery to limit any suspected bleeds that we can potentially see arising. This may be placing extra sutures on blood vessels, but we're very meticulous during our surgery to make sure you don't leave the operating room with any concerns for bleeding.
The reason for the increased risk of bleeding is that blood clots historically had been one of the greatest causes of death after surgery. Because of this, we do use blood thinners before you go to sleep with surgery. Of course, doing surgery when somebody has just received a blood thinner may slightly increase the risk of bleeding, but this has been something that is easily managed by attendance to perfect surgical technique. The problem has been that when a blood clot occurs, if it breaks off and goes to the lungs, it can be a fatal pulmonary embolism. Nowadays, we see this much less commonly than in the history of bariatric surgery.
Heart attacks or acute coronary events are certainly something that's also on our mind. Because of this, we would never let you go to the operating room without careful evaluation if you have any history of cardiac disease or a significant family history. The way we try to mitigate this risk is with careful preoperative evaluation with cardiologists, primary care doctors, and other specialists.
A stomach narrowing or stricture is possible with any 3 operations that we've described. This is something that can vary based on the actual operation. It usually can be managed just with an endoscopic dilation, meaning that we go down through the mouth with you under sedation and stretch the area of narrowing with a balloon.
Hernias are a potential risk after any abdominal surgery. In recent years, now that we use laparoscopic or minimally invasive surgery, the risk of the hernia is much lower. But it's important, again, for close follow-up so that we can keep an eye on your incisions and detect a hernia early if it's going to happen.
Injury to the spleen was much more common with open surgery because of the use of hands to retract the spleen. Nowadays, with laparoscopic techniques, it's become much less common. The way to avoid this is attention to detail and avoidance of putting any pressure on the spleen.
Pneumonia or pulmonary complications are also another thing that's on our mind after surgery. If you have a history of obstructive sleep apnea, asthma, or other COPD, other pulmonary complications, we encourage you to continue your inhalers before and after surgery. And if you have a CPAP machine, we actually ask you to bring it and continue to use it the night of surgery. It's because of things like pneumonia that we encourage early ambulation, deep breathing, coughing after surgery in order to decrease this risk.
The risk of death is approximately 1 in 1,000. While this risk can seem somewhat high, it still remains lower than what we see with gallbladder removal, hip, or knee replacement. It is also important to keep in perspective that the patients that undergo bariatric surgery are often poorly controlled diabetics, people with high blood pressure, and significant sleep apnea. The way that this has been reduced over time is by prevention of blood clots and optimization of the patient before surgery.
Now we'll talk a little bit more about some of the possible side effects of surgery. So these are different than risks in that these are things that potentially could happen with your new anatomy, especially if you deviate at all from the recommended care after surgery. One of the common issues is something called dumping syndrome, and that's something we see in patients after a gastric bypass. Now what happens in this situation is the new intestine that's been brought up to your stomach isn't used to seeing raw sugar and starches and carbohydrates like it's going to after surgery. If this happens, it can cause intense nausea, cramping, diarrhea, flushing. If you're diabetic and you've ever been hypoglycemic, that's exactly what it's going to feel like. Now, it can be a spectrum from everything of feeling bad to being potentially dangerous. Now, in some ways, this is seen as kind of a negative feedback mechanism. Say a couple months, weeks after surgery, you just wonder what chocolate tastes like and want to cheat a little bit. It's potential that as that chocolate hits the first part of your intestine, it's going to send you into this very unpleasant feeling. something again we call dumping syndrome. The way to avoid this is with careful attention to your diet and nutrition after surgery. Temporary hair loss is also somewhat common, especially if you're not meticulous with your replacements with your nutritional supplements after surgery, and sometimes even if you are. Women tend to be the ones who bring it to our attention most often. Usually it's around 6 months after surgery and almost always is temporary. Gallstone formation is another potential problem. At periods of really rapid weight loss, you're at higher risk for gallstone formation. So if you still have a gallbladder, there's potential for that to become an issue. We ask our patients to take a certain medication to minimize gallstone formation for about 3 to 6 months after surgery at times of really rapid weight loss. Stomach ulcer is also something that we watch for, again, something we're most in tune to with our gastric bypass patients. And this again is because that new intestine that's been brought up is a little bit sensitive to raw foods. And where we suture everything back together, sometimes if there's not great blood flow, it can be a problem. If you have bad diabetes or smoke, again, this is why we ask you not to smoke before surgery. Again, a careful follow-up and paying attention to your symptoms after surgery is how we would detect these. Vitamin deficiencies, it's going to be an expected problem if you don't keep up with your supplements. Increased fertility. Now, some people are having the surgery to reach this desired effect, and that's awesome. But it's also, we consider it something of a side effect and something we ask you to be very cautious of. We ask all our patients to use at least 2 forms of birth control after bariatric surgery because of increased fertility afterwards. Now, if you want to have a baby, that's awesome, but we ask that you please wait until at least 2 years after your bariatric surgery, because during this time, any pregnancy is incredibly high risk. While you are struggling to meet your nutritional needs with the new malabsorption that you have, if you're competing for that nutrition with a new baby, you're going to win every time, and the risk for birth defects and problems with your pregnancy is incredibly high. Loose skin is another potential side effect. As you lose weight, there's a chance that the skin doesn't sort of retract with the rest of you. And this can lead to kind of some skin folds in your abdomen, legs, arms, that can be bothersome. If this is still becoming an issue 18 months, 2 years after surgery, then we refer you to some of our plastic surgery colleagues who can help you with this. But again, we do ask that you wait until about 1.5 to 2 years after surgery when you've reached your new steady weight before you take on another surgery.
The first step is doing this seminar. After this, there are multiple steps required in order to get through to bariatric surgery. It is our job to help you achieve those goals. This can include 3 to 6 months of medically supervised weight loss.
Essentially, what this means is that the patient comes in and visits with the dietitian and our physician assistant every month until they achieve whatever time period their insurance dictates.
This is not something that we're able to determine. It's not something that we can negotiate with. This is something that the insurance has predetermined that is necessary before you can undergo bariatric surgery. In addition, you will have to consult with a dietitian, with an exercise specialist, and also perform a psychological evaluation. Psychological evaluation is essential to make certain that any factors with regard to anxiety or depression are dealt with prior to surgical intervention. Lastly, we will have to perform preoperative weight loss in many patients in order to make the surgery as safe and effective as possible. Please remember that you may need additional testing or imaging before surgery.
So we'll talk about some of those points in a little bit more detail. It's really important to remember that this whole process is not just about the surgery. It's very important to develop good habits, nutrition habits, lifestyle habits that will make you successful before and after surgery. So let's go over some of that in a little more detail. As Dan said, this is more than just surgery. This is a lifestyle change. The surgery alone will not get you to where you want to be. It's important to develop better eating habits and nutrition. Now, you may not know much at all about how to read a nutrition label, what a protein, fat, or carbohydrate is right now, and that's fine. Part of the 3 to 6 months of guided weight loss is to educate you about these things so that you can use food as fuel and you know how to eat healthy after surgery. We also find that exercise is an incredibly important part of this process. Now, the word exercise might scare you, and that's okay. Exercise is different for everyone. For some people, it's riding a bike. For some people, it's doing a triathlon. For some people, it's stationary exercises in a wheelchair or standing and sitting exercises. Here we ask you to meet with some of our occupational therapists or exercise specialists before surgery so that they can help you figure out what a good exercise is for you. And ongoing support through this process is incredibly important. Now, maybe it's your family, maybe it's friends, but we do encourage you to try to attend some of our support groups if you can, just to talk to people who've been through the process again. It's not just talking about the successes, they also talk about the struggles, and it's very helpful to know about those things before the surgery if you can. Now again, the first 3 to 6 months before surgery, these are the things we focus on.
We want you to learn how to eat healthy. You'll meet with our dietitians and our physician assistant and talk about how to start working towards the diet and lifestyle modifications that you will have to have in place after surgery.
We have you keep a food journal. We have you learn how to read nutrition labels. We start weighing food and measuring your food. We also want you to get moving. Like we said, some of this can be with the exercise specialist. Maybe you're already really big into exercise. We'll make sure that you see them, and maybe they can even move you farther along. Again, please don't do it alone. We offer support groups. Social media offers a lot of support groups, but having someone alongside you for this is incredibly important. As you start getting farther into the process, we start looking more at some of the requirements that Dan listed below. Your health insurance is a big part of this. Health insurance and health insurance companies dictate if you can have the surgery, when you can have the surgery, and what has to be done beforehand. We start looking into that the minute you start in this program so that there are no surprises. But it's important for you also to look at financial obligations that you might have for this. Vitamins are expensive, transportation can be expensive, so these are all things that need to be looked into before surgery.
At your first visit with our physician assistant, you're going to go over in detail your medical history. If you've had prior surgeries, prior illnesses, prior hospitalizations, we're going to want to know about all of that because we want you to be in the best shape you can be by the time you go in for surgery.
The other thing is to stay committed. Set goals. The goal you have on your last visit shouldn't be the same goal you have on your first visit. Step by step, we want to get you to a place where you can make the lifestyle changes, the diet modifications that'll make you successful after surgery.
Historically, bariatric surgery was performed as an open operation. These operations are incredibly complex, and most surgeons wanted to be able to feel the tissue as they manipulated it. Over the last 15 to 20 years, there's been incredible growth in the use of laparoscopy in performing bariatric surgery. The benefit to the patient is that this accelerates recovery, meaning that the length of stay has gone from approximately 5 to 7 days to approximately 1 to 2 days. In addition, the less pain means less likely to have pneumonia, less stress getting up and moving around, less stress in taking care of yourself. With this, patients have an easier recovery and less pain, which is a huge benefit to their overall physical state. In addition, after surgery, it's important to realize that there's going to be physical changes that occur for the first 18 months after surgery. This includes the loose skin that Dr. Pierce had mentioned, the clothes not fitting, but also that some foods may taste differently than they had previously, that your appetite may be gone. In addition, you will have more frequent visits to the lab, meaning that you will have to have your blood drawn at least every 6 months for the first year, and then perhaps yearly after that. And you will require the need for supplementation, including vitamins and minerals. These are not expensive vitamins and minerals. These are very common that many of you may be taking already. But they are needed after surgery, and it is important to be able to afford those. After surgery, there's great change not only in physical appearance, but also in your metabolic state, meaning that your blood pressure will be lower.
This is great for people with high blood pressure. In addition, your cholesterol numbers will improve and diabetes as well. This varies based on the surgery and on your preoperative condition. It is important to discuss this with us at the time of your preoperative visit because we can give you a better idea which surgery will have the greatest impact in regard to these factors.
Now, while the first 18 months to 2 years after surgery, the most obvious and immediately gratifying changes take place, there are lifelong benefits to having this surgery that we want to remind you of. A couple of them are listed here. One is that we know that people who have bariatric surgery actually live longer when you compare them to people of their age and weight match. We know that there is decreased risk of some cancers, especially in women, decreased risk of first-time cancers. As Dr. McKenna mentioned, we have remission of type 2 diabetes in many patients. What we also know is that patients who don't have diabetes, who are at very high risk for it, have a decreased incidence in developing it lifelong. So how can you be successful long term? Now listed here are a couple of key tips that Dr. McKenna and I have noted to be common among all successful patients. One of them is to keep your follow-up appointments. We ask to see you frequently in the first year after surgery, and then at least annually for the rest of your life. This is a lifelong change with the need for some lifelong lifestyle modifications. And follow-up is important so that we can help you watch for things or potential pitfalls and help you be successful. Please attend a support group. Maybe that's in person, maybe that's online, maybe it's some other means of social media. But get in touch with people who have done this before so you can talk to them. Knowing what to potentially prepare yourself for is incredibly important in being successful. Please exercise regularly. Maybe that's not something you do at all right now and something you're afraid of. Working with our exercise specialists can make this something that you can enjoy. Please drink plenty of water and eat a lot of protein. You're going to hear this from us over and over again throughout this process, water and protein. And then last but certainly not least, focus on your health rather than on your weight. Please make the emphasis being on the number of pills you're no longer needing instead of the number of pounds you're dropping.
As a part of these changes, it's important to realize that there may be some financial accountability necessary. This means that there may be some out-of-pocket expenses, including vitamins, lab tests, and changes in your dietary habits. When it comes to eating healthy, our dietitians can often work with you to figure out how to afford the foods that you need. Also, please realize that just wanting to be a surgical candidate does not necessarily make you a surgical candidate. We have to optimize all physical conditions to make sure that you are at as low a risk as possible to undergo the surgery. In addition, we want to make certain that patients that undergo surgery are successful. Patients with untreated or unmanaged psychological conditions make poor surgical candidates. So we do often require patients to demonstrate compliance from a psychological standpoint before surgery. Many patients wonder why we do this. The reason is that you have one chance of success in having bariatric surgery. This is the first operation. Those hormonal impacts, the loss of appetite, will never occur again with another surgery. So it is essential that the first operation be when you are most ready for this adventure.
So why join our team? We know that there are a lot of different bariatric programs out there. Dr. McKenna and I are very proud of the team that we've built here.
We're both board-certified general surgeons, fellowship-trained in minimally invasive bariatric surgery. Our team includes a dedicated physician assistant to work with you before and after surgery. Our program is very comprehensive. We include exercise physiologists, psychologists, dietitians, all of who we think are great educators and also are very interested in your success. We're with you throughout your journey.
So let's keep the momentum going. You've already completed the online seminar, and now, if this is something that interests you, I would recommend calling 920-288-5868 to obtain additional information or to just schedule an appointment with our team. During the office visit, we will establish shared goals between yourself and our care team members. Having completed the on-demand seminar, we encourage you to go one step further and complete the post-seminar quiz. Once you've done so, our office will contact you and help get you on your way to improved health and wellness.
Thank you for watching. We hope we've answered most of your questions about bariatric surgery. If you have additional questions, please call us at 920-288-5868. We'd be happy to assist you.
Every accomplishment starts with the decision to try.